Hi, good morning. My name is William Hull. I'm a neonatal nurse practitioner student. I'm going to be doing a head-to-toe assessment on a newborn neonate. I'm going to grab all my supplies. As I said, this infant is a former 35-weeker, 3-day-old. Based on my first initial inspection of the infant appears to be pink. Skin is clean, dry, and intact. A patient is able to move extremities appropriately and symmetrically. The infant appears to be well fed, no signs of dehydration, also no signs of respiratory distress. I do not currently see any gross deformities of the infant. No gross deformities noted. As I said, the skin is clean, dry, and intact and pink. Cap refill on fingertips is less than 3 seconds. Baby appears to be moving appropriately. No sign of any bruising noted throughout the skin. Let me roll the head back. Let me lift the head up. No sign of bruising, no Mongolian spots, no cuts or scratches or anything like that. Temperature is warm. Soda is warm throughout. No signs of birthmarks that I can see. Now I'm going to go ahead and assess the infant's head. So the infant's general appearance of the head is symmetrical, no signs of laceration or bruising, no obvious deformities noted. I'm going to go ahead and palpate the head. Patient's head is firm. I'm going to, again, no sign of obvious deformities. I'm going to go ahead and palpate her fontanelles. The anterior fontanelle is 2 by 2. I'm going to go ahead and go all the way back to the posterior. The posterior is 1 by 1. The sutures of the head, of the scalp, are approximated, not overriding. No bogginess noted throughout the scalp. Hair appears to be sparse throughout. No swirls noted, no whorls noted. Go ahead and go to the back of the head. Back of the head appears normal. Now I'm going to go down and look at her ears. The pinna of her ears has instant recoil. Both are firm and formed. No sign of drainage on either side. The inner ear canal is at the level of her eye, so it is normal set. Her eyes appear to be clean and intact. No drainage noted. Her sclera is white on both sides, and her conjunctiva is pink on both sides. As I said, no drainage noted. I'm going to go ahead and do a quick reflex test, red reflex test. Red reflex noted to the right and to the left. I'm going to go ahead and look at the nose. Infant appears to have bilateral nostrils. No drainage noted. Moving down to the mouth. Infant's lips appear to be clean and intact. No sign of cracking or lacerations. No blisters. And then I'm going to go ahead and feel her palate for a cleft. Alright, no sign of cleft palate all the way through. Patient is giving me a firm, strong suck. Alright, now I'm going to go down to her neck. Patient's neck appears to be soft throughout. Patient is able to turn neck both passively and actively. No signs of distress noted. I'm going to go ahead and roll the infant so I can visualize the back of her neck. No signs of deformities noted. Infant appears to be well. Now I'm going to go ahead and move to her chest and her abdomen. First, physical assessment inspection of her chest. Baby appears to be breathing easily. No retractions noted. No signs of respiratory distress noted. I do not see pulsation of the pericardium. Infant appears to be breathing very easy. Again, I'm going to roll her to her back just to look at her back. Again, no sign of deformities or anything like that. I'm going to go ahead and take a quick listen to her. First, I'm going to listen for breath sounds, and then I'll move on to cardiac. Now I'm listening to heart sounds. First is the right second intercostal space. Next is the left second intercostal space. Next is the right fifth intercostal space. And lastly is her point of maximal impulse, which is her left fifth intercostal space. No murmur noted throughout. I'm going to go ahead and roll infant to her back to listen. Okay. Infant's breath sounds are clear bilaterally and throughout. Again, no signs of respiratory distress noted. Now I'm going to go ahead and assess the baby's abdomen. Upon inspection, the baby's abdomen appears to be rounded, not distended, no discoloration noted, no obvious deformities noted. Before I palpate, I'm going to go ahead and listen. Bowel sounds noted in all four quadrants. I'm going to go ahead and palpate the abdomen. No masses noted throughout the abdomen. Patient does not appear to be in any type of distress or any pain. I'm going to go ahead and palpate for the liver. Liver is 1 cm below the right rib cage. I'm going to release very gently. Again, patient shows no sign of pain or discomfort. I'm going to come over here and onto the left side and palpate for spleen. I do not feel the spleen. Now that I've assessed her genitourinary system, I'm going to assess her musculoskeletal system. As I stated before, infant moves all extremities without any signs of discomfort noted. Patient's movements are symmetric and equal. Jerky movements only noted when full extension occurs of the extremity. Like I said before, no obvious signs of deformities or masses or swelling. I'm going to go ahead and passively turn the infant's neck to either side. As I stated before, and when I did the head, ears, eyes, neck, and throat section, patient did not show any sign of strain or any grimace or any pain. Now I'm going to go ahead and palpate the clavicles. Clavicles are both intact. Now I'm going to go ahead and work my way down on her arms. I'm palpating for any masses, any deformities. I'm also looking for her grimace. There are 5 fingers on the left hand. No polydactyly or syndactyly noted. Creases are noted in her palm. On her right hand, 5 fingers noted. No polydactyly or syndactyly. Creases are noted in her arm. Cap refill is less than 3 seconds throughout. Now I'm going to go ahead and work on her legs. No masses noted on her legs. No bruising or any type of deformities noted. On the left foot, there's 5 toes noted. And creases noted throughout her foot. On her right foot, 5 toes noted. Cap refill less than 3 seconds. And creases are noted throughout the foot as well. Now I'm going to go ahead and look at her reflexes. So I've already done the swallow reflex when I initially checked, or suck reflex when I initially checked for palate. So now I'm going to go ahead and check for her grasp reflex. Okay, infant is holding on tight. I'm going to go ahead and attempt to lift infant up and see what she does. And infant is rising with me as I lift her up. Okay. I'm going to go ahead and check the Babinski. Toes are flaring out. Toes are flaring out. I'm going to go ahead and check her rooting reflex. Baby's turned her head to the left side when stroked on the left side. Okay, right side, I'm going to go ahead and pick the baby up. And I'm going to go ahead and check her stepping reflex. Patient is putting full weight on legs. Assessment is finished with her. Throughout my assessment, her behavior was calm, quiet, and collected. At times, especially when my stethoscope was placed on her, she did get a little agitated, but other than that, she did very well during my assessment. She was able to calm herself, and I had no issues. I did not notice any type of signs of pain. Like I said, patient had no deformities. Did not seem that patient had any type of fractures. Abdomen was soft, round, no signs of respiratory distress, no signs of abdominal guarding noted. I would rate the patient's pain at a 0 on the CRY score. And that's it. Physical assessment is done. Thank you.